Hi, everybody. Thank you for joining us this evening. I am Brenda Green, the founder and CEO of the Be Strong Group, and we welcome you to our next Tuesday chat. We're excited about part two of tonight's topic, but just to remind any new followers, I am the founder and CEO of the Be Strong Group that my husband and I founded in honor of our son, Braden, that has sickle cell disease. And so our mission is to spread awareness of sickle cell disease through education, advocacy, and empowerment. And we wanted to use these virtual opportunities, to share with you, with our community, with our fellow warriors, with our fellow caregivers of warriors, topics that are important to us. And so tonight, we're actually in part two of a topic of self-advocacy, improving your healthcare experience. And if you were with us the last time, we had Denean Greene-Rivers, who shared some very good information. She talked to us and let us know that we are the owners of our team. So as a parent of a child with a chronic illness, his dad and I are the owner of the team, and he is our star player. So that was a good gem. If you haven't seen it, it's available on our Facebook and YouTube channel for you to go back and watch this great information. So tonight, we have Ms. Greene-Rivers back to talk to us about some additional information about self-advocacy and improving our healthcare experience. So again, help me in welcoming a global patient advocate, a fellow mom advocate, and my friend, Ms. Denean Greene-Rivers. Welcome back, Denean.
Oh, it's so good to see you. And I'm always excited to be here and be a part of what the Be Strong group is doing. So thank you.
You're welcome. We are so excited to have you. I appreciate you so much. And Denean, I know we have some people listening right now. And for those who are listening on the replay, you're in for a wealth of good information. So Denean, I'm going to let you take it on and tell us what you have in store for us tonight.
Ooh, well, for those of you who weren't a part of our last live session, I'm going to go ahead and give you just a snippet of what we talked about. And one of the pieces was about the power of the pen and paper. So the power of voice is important, but it's also important for us as advocates, patient advocates, and caregivers to always document on our own, not just wait on our providers to document and give us feedback in writing, but for us to be able to document some things. So today, if you have your trusty pen and pad, I would suggest that you pull it out or at least go back and revisit, because our first half of the hour, we'll be talking about why it's important to know about medications, especially if you have a child or a loved one who has a chronic illness. So most children and adults who are chronically ill are usually on more than 3 to 4 meds, more than 3 to 4 meds. So we're talking 4, 5, 7 medications at one time, and that can include non-prescription meds, as most of us don't like to think about herbal medicines and vitamins, but I always consider those things as medications too. So I want to give you a couple of gems or a couple of questions that maybe you didn't consider when you go in to meet with your provider. The first question that you might want to jot down is, why is this medication prescribed? Why? And we just assume, well, the doctor said it's the flu, or my loved one has hypertension, and whatever they say goes. So if this is the medicine, I won't ask anything else. And they could have other outlying issues, but we just assume, we take everything at face value, and we don't always dive into the why. So any medicine they give you, ask, well, why is this particular medicine prescribed? Is it the only one? Is it a generic, or is it a name brand? Is this the best medication for my loved one or my child at this time? You should also know, in addition to why, how does this medicine work in my child's body? I mean, when's the last time somebody really asked that? We just take things again at face value. The doctor prescribed it. It must be okay. Most great doctors will go ahead and tell you even about side effects early on or how these medicines interact with your child. But if they don't be afraid to ask, how does it work? And then another thing for you to think about is start talking to your doctor about the side effects early. They may list one or two tired. Will your child be anxious or jittery or sleepy after taking that medication? And how will they improve? What are the improved symptoms or the improvement I should be looking for when my child takes this medicine? We ask about side effects, but we don't always ask about what we should see or what we should look for in our child or our loved ones for improvements. So, for example, if you were prescribed a medication for diarrhea, well, the improvement should be that you should not have diarrhea after taking the prescribed medication. And if you develop any other symptoms, that you are also documenting those symptoms down. One of the other things that you can think about is how often, and we don't always look at how many more prescriptions will we need. Will there be 2 or 3 refills? Can I get the additional refills early? And if I need the refills, what do I need to do to get them? Will you automatically call in to the pharmacist for me? Some doctors do it, some don't. Brenda, you have anything you want to add to that? Because I get that all the time. I will get a prescription for my child and my loved one, and I don't always look on the prescription because now they're electronically done, and we don't always know whether or not there are refills associated. And we oftentimes wait on the pharmacist to tell us right when we need the medicine that you need a refill. And sometimes the pharmacist asks for you to call your provider, and they don't always call your doctor to get your refill. So early in the appointment, ask about, will I need additional refills? And how will the refills get to the pharmacy? Is that up to me as the patient advocate or the caregiver? Or is it up to the pharmacist? Or is it up to you? Establish that early and make sure you write that down. So that's another little gem that we just have a tendency just to kind of brush over, and we shouldn't do that.
And Deneen, I do have something to add because that's a great question about the refills. And I was going to ask you, um, because I know I include our pharmacy, our pharmacist,
Mhm.
as a part of our team. So our pharmacist knows our family or knows Braden. So they are aware, and I make use of the app. But I was just going to ask your thoughts about making sure the pharmacist, if you have a regular pharmacist, to keep them apart so it can make those situations a little easier.
But so we're let's talk about the pharmacist for a reason. This is really important because most often we have more than one pharmacy we're going to. Just like we talked about doing your research on the right provider or the right doctor, you also need to find a good fit and a great pharmacy to take care of all of your medication needs. There are some people, young and old, who might need compound medications. And what that means is that maybe you can't take a pill. You need a liquid form of that medication to take. Well, what if your pharmacy can't do compound medications? And so then, and you're on maybe 5 different medications, and out of the things to be able to one time. Does that answer your question?
I was on mute. It does. It does. And Deneen, I don't know. I think we had a little interruption in the answer of my question from you. So I wanted to be sure that we didn't miss it. But I did catch the end of it.
Well, mainly what I'm saying is if you are using 2 and 3 pharmacies, that's a red flag. If you don't have to, don't do it. Find the best pharmacy that is closest and most convenient to you. Maybe there's a pharmacist that you have a great relationship with. It's in close proximity either to your work or to your home, or they could possibly help you out with delivery, with free delivery. So there are some things that you should look for in a pharmacist, just like you would look for certain things in a provider. And I always suggest using one pharmacy. And it's important because although certain healthcare systems may talk to each other, and in certain states, the pharmacies should be able to interact electronically with one another, it helps because if there is a problem, they can catch it if it's just one pharmacy. You don't want to keep hopping from every Walgreens and say, well, I'm with Walgreens. Well, it doesn't make sense if you're getting one Walgreens from the east side of town and then you go to the other Walgreens for some other medication. Maybe it's the same system, but you're still dealing with more than one building, more than one pharmacist, and it can get a little tricky when you start going to multiple pharmacies for your meds. So I suggest always use one.
Great point. And Deneen, I didn't know if you wanted to take a question. We do have a question in the chat, and this is about the amount of medicine. How or when do I know to question the medicine intake or the amount?
Good question. Well, the first thing is are all of I would look at where those medications are coming from. Like, do they come from just one doctor or they come from we get to making note, your doctors should have a list of all of your medications, whether they prescribed it or not, whether they are in the same healthcare system or not. This is important because there may be some medications that overlap and do the same thing. Maybe there's a way to cut out or eliminate some medicines that either one may interact with one another in a bad way that could cause some side effects and not helpful for you, or it could take the place of some medications, maybe two that are on there that you don't need. So it's always really important for you to keep a running list of all of your medications. So now most hospitals and doctors' office have a system where they can print out all of your medications. I would suggest researching online too. There are some free programs, some free apps out there where you can go in and actually plug in your medicine, put the name of your medicine in, and it will give you the brand name, the generic. It will even drop down the dosage for you. And if you can't do that, your nurse or doctor needs to do that. And if you're on multiple medicines for the same thing, then I would be asking the question, should I be on all of these medicines or is there a time to wean me off of some? And I'll give you an example. So my son is on, well, he was on 3 different high blood pressure medicines. And at some point, all of those medicines weren't necessary. So we had a conversation with the prescribing doctor to say, number one, only one doctor should be prescribing the same sort of the same type of medicine. And why do we need all three? Is there a way for us to look at changing the dosage of the better medication for his body and reducing maybe one or both of the others? Well, that question was just asked at a recent visit that we had in DC for the medication. And the answer came from the doctor to say, well, one actually serves two purposes. One helps him with the transplant organ, and it also helps to keep his blood pressure medicine down. So let's keep this one. And so we can wean them off. And there'll be some things for you to do. So I would ask, when you come off of those medicines, ask the doctor, what are some things for me to look for or to monitor and watch to make sure that my child or my loved one doesn't need to go back on the medication. So remember, you are the first line of defense for your loved one, especially if you're the one helping to administer these medications. You
Oh,
should know, yeah.
absolutely. And Denean, I know I wanted to, or I failed to mention in the beginning of before we got started. And just to let our listeners know, the information that we are sharing is for educational purposes only. Any questions that you have that are specific to you or your child, you make sure you take these bit of good information, questions to ask, and go back to your child's provider or to your own provider and ask them for their opinion for anything that's specific to you. So I just wanted to briefly make that statement, Denean. But thank you, thank you, thank you.
Absolutely, always. And these are questions.
Mm.
These are not suggestions for you to stop doing anything. I am not a medical doctor, and nor do I claim to be. So, being the owner of your team, you still have coaches who are part of your team, and that would be your providers and your doctors. So, always consult everyone else on your team. I do not suggest stopping or starting something without your provider's knowledge. That is really important because as caregivers, and we love our little ones, we love our family members, and we have fought and cried and prayed and some long days and nights for them to be here and to be safely here. And so we don't want to impede their progress, their healthcare progress, and we want to see them continue to flourish and grow. So these are just questions of things that maybe you didn't consider asking. One of such is, how does this medicine interact with food, and when would be the best time for me to give these medications to my loved one? We don't always think about whether or not we should, or we have heard that maybe you should take your medication in the morning with food, but there are some medications maybe the doctor will tell you you cannot take with food, or you can't eat grapefruit with this particular medicine. And you certainly should not be doing alcohol with any medication. Now, I'm not a doctor, but I've never seen any medication label. I've never seen it. And I surely wouldn't recommend trying to mix alcohol with medication. That's a no-no. Never do that. As a matter of fact, don't even ask your doctor, can you do it? Just don't do it. Don't do that one, okay? And let's talk about considering mixing medications. I would suggest, when you get your list of medications, that you talk with your nurse and doctor about when are the best times if your child or your loved one needs to be on a schedule more than once a day for their medications, looking at the perfect time doctor's appointment. You may get an already pre-made time determined for you and your loved one. But that time to take the medication may not necessarily work for you and your child. What if that's the time where they're doing some sort of physical activity, or you're at work, or they're at school? And yes, we have school nurses, but look at what is useful for you in your life and your family. What's your availability? Or if you're not the one administering the medication, then you should be talking to that other party to say, what are some good times to make sure that you are consistent with the same time each and every day for administering medication. That's important, and it helps with the efficacy of that medicine and to ensure that that medicine is working regularly in your body.
Okay.
Okay.
Denean, we have another question in the chat, if you don't mind.
No.
Take a look. Okay, Brianna is asking, what's the importance of how you are feeling while on a certain medication compared to the benefits of it? At what point should you consider talking with your doctor and switching to a different brand?
Well, let me plainly put it this way. If you are on medication that's good for you, but it's debilitating your ability to lead and function your everyday normal activity, if you can't get out of bed, if you're having a problem with your daily activities and mobility, if you're continuing to have headaches that are caused by these medicines, or there's an issue where you could probably have what they call adherence problems. Sometimes the medication can be working, but the side effects are so bad that you emotionally and mentally, people will just desire not to take it. So then it doesn't work at all. There is nothing wrong with going back to your provider and saying or asking, first of all, be honest. I mean, if I can be frank with you, and there may be some children listening, I tell people when you are with your doctor, that is the most fragile time. It is the most intimate time that someone can have outside of being intimate with your spouse or your husband or your partner. The doctor gets to see certain parts of your body that maybe your spouse won't even see. I mean, let's think about that. When's the last time some of you adult people in the audience, mamas and daddies, have seen your private areas? Probably not since you were a toddler or a baby. But if you go to the doctor, you're going to have to undress and unveil your physical self. Not only that, when is the last time you honestly shared something health wise that's been going on with you, with your loved ones, and not with your doctor or vice versa? The majority of the time, you're sharing things with your provider that you're not even sharing with the people that are under the same roof with you. You know, we give them little snippets. We're not always being as specific. And you've got to be intimate on a whole nother level with your doctor so that you can be prescribed the right medications. So if you're not feeling good, even if you think the medicine is working for you, but the side effects are so bad that it's leading you emotionally and mentally in a place where you don't want to take it, then it's no good. How can it be good for you if you're going to eventually decide on your own to stop, possibly skipping the medicine? It is better to go back to the physician and say, be honest. This is how this medicine is making me feel. 9 times out of 10, there is some other alternative that the doctor can either prescribe or do to assist you so that you don't have those adverse reactions or side effects. So I hope that answered your question.
And Denean, I'm glad you said that because I know, with my son with sickle cell disease, he's on a variety of medication, and one of which that was new, and the dosage has to be carefully monitored and then changed just to make sure we get to the right dosage. But it's so important to let his hematologist know any side effects, any symptoms that may be outside of what the lab shows.
Mm.
And therefore, I have to tell my son, since he's old enough now, to kind of be open and honest with me so we
Yes.
can be sure we convey that message to his hematologist to make sure it's doing what's best for him. So that's a very good point and things we need to consider.
Which leads me to this, Brenda. Just like you have, and most parents have, uh, pretty much embedded in our child's minds and everyday lives to come to us, at some point they end up being adults and moving into the adult world. We are part of medication safety and compliance is not the best word to use, but we want you to be empowered even with medications that you're taking. So part of that is liberating your young people to be able to share exclusively and explicitly how they are feeling and what this medication is doing to them. Because what if you're not around? When he goes off or she goes off to college or gets married, or is not in your even in your four walls, but they decide they want to take over administering their own medications, or they just don't want you in when they get ready to have their doctor's visits. They need to feel good about building their own relationships with the provider and be able to speak candidly with those doctors when you are not in the room. If we start now with being honest and sincere about what medication is doing to us, then we'll be honest and sincere in sharing that with the doctors. And truth be told, a lot of medicines affects our emotional and mental state.
Mhm.
We often talk about the physical state of these medications, but when's the last time you really asked your loved one, what does this medicine do to you emotionally or mentally? Psychologically, how do you feel if you're diabetic and you have to take insulin?
Mhm.
Maybe you had juvenile diabetes and you're on continued medication, and you're at an age now where you've got to check your own insulin, give yourself your own insulin injections, and you're at school. How do you handle that? How do you talk with your friends about your chronic illness? Have you shared that you have sickle cell? And what does that communication look like? So these are some things that early on, I think as parents and loved ones, we need to start empowering our kiddos not to be ashamed of anything dealing with their health care. That is an empowering moment to be able to take charge of your own health. How amazing is that? That's like a rite of passage in itself, because at some point, we as human beings, we're not perfect. Our bodies are built to eventually break down. At some point, we will need some sort of medical advice or attention. Maybe not medicine. Nah, some people decide never to do anything or to do more holistic, treatment. But at some point, you will need to have a medical provider be a part of your health journey. And so, why not start with being honest now?
Oh, this is great information. And again, everybody, we're talking with Miss Denean Greene-Rivers. We're talking about self advocacy and improving our healthcare experience. She's sharing some great topics with us, and topics that we can share with our young people too, as well. And Denean, you mentioned that part of empowering our young people to be able to have that experience with their medical providers. And that's a key moment, especially now we're in the midst of it. We call it that transition period
Mm.
from pediatric
Oh,
care to
yes.
adult care. So that is a crucial period for our young people with chronic illnesses, from my perspective. So thank you.
Absolutely. You're very welcome. And if I can, there's a ton of other questions we can I can share, but if nothing more, you know how you go to the pharmacy, and a lot of times now we're just ready to get our prescriptions and get out, and they will ask you, sign this keypad. If you do you have any questions for the pharmacist? How many of you say yes? Well, last time you said yes. Or even if you didn't have a question, they might say, well, would you like to speak with the pharmacist to learn a little bit more about the medicine? It'll be your first time on there, and you're just ready to go. you, Lord, let me just put my hand up in the air. I have been in the line. I have waited so long, and I'm like, oh my gosh, well, I'll call them back, or I'll just call my doctor's office, or my doctor really just took 2 minutes and brushed over everything that I needed to know really quick. I'll read the package when I get home. if you got an extra 2 minutes, call them on it. I said, yes, you know what? Have the pharmacist come to the window. Is there anything that I may not have thought of or that I could possibly overlook when I'm getting ready to administer this medication to my child? What is the number one thing I need to know about this medicine? Just ask them. They get paid to tell you, and they want to tell you. And you're not talking to a pharmacist tech. You're not talking to just somebody ringing up your prescription. The pharmacist will actually come and share some insight on the medication. So the next time you go to the pharmacy, just ask them. I don't care if it's 5 or 6 medications. Ask them, what is the main thing that I need to know about these medications? Or side effects. What side effects do you hear most often from this medication? Or my child could take. So that's my tidbit for you with pharmacy related questions and medications.
Oh, all right, Deneen. And those are some excellent questions that we can all put together, have in our journal with our pen, the power of the pen. Um, and those are some good tools to share with our listeners. And the message I got, it's okay to ask. We're the owners of our team. It's okay to ask and consult with the people
Yes,
on our team when it's concerning either our health or the health of someone we love. It's okay to ask.
absolutely. Please ask.
Hmm.
Please ask. Even if you think you know, just ask.
Hmm. So that was a good. Is there anything else you want to transition to, uh, Denise?
Well, let's transition to asking people to wash their hands.
How about that part?
How about that? When last time you asked somebody to wash their hands? So I always like to tell people, back in the day, I feel like we're just having a conversation here, so I'm just going to be
Mhm.
honest with you all. So I'm just going to say Big Mama. When you would go to Big Mama's house, one of the things that you had to do before even going in the kitchen was what? Wash your
Wash your
hands.
hands.
You go in the bathroom and you come out, what did she say? Did you wash your hands?
Wash your hands. Hmm.
Go back if you didn't wash them again. So cleanliness was always next to godliness. So, and that still holds true today. But I want to tell you that clean hands out here can help save some lives. And if we're talking about in empowering ourselves in healthcare and making good healthcare decisions, I want you to know how important hand washing is. So this COVID thing has us all acting like we just learning about washing our hands for the first time. Now y'all know the importance of washing your hands, and if you don't, let me tell you how even more important it is when you are sick or you are going to visit someone in the hospital. Do you know that there are respiratory infections, flu and cold infections, and viruses that can kill and hurt people just because you have touched someone without washing your hands? It is important when you go into your doctor's visits, when you go into outpatient or inpatient in the hospital, that you are watching your providers wash their hands. And I don't know the last time anybody actually even paid attention. We just assume because the hand sanitizer foam is on the outside of the door leading into the room, or that it's in the inside of the room, or we're distracted by so many other things, we may not pay attention to that. Well, I want you to be empowered to ask your providers, visitors, and family members to wash their hands. Not just wash their hands in your home, but when they come to visit you in the hospital. So I had a girlfriend to tell me, well, she was in the hospital. The doctor came in and she didn't see the physician foam up or wash their hands. So the physician said, well, I did on the outside before I came in. Well, her door was shut. So how did the person open the door after they foamed up, then came in and proceeded to touch the patient? Did you use your coat? Did you pull it by your knee or your foot? I don't know, but I would feel more comfortable and safe if I see my doctors wash their hands. And so I'm going to tell you a story. I have a good friend of mine, and this was during COVID. She had conjunctivitis. So if most of you don't know what that is, it's pink eye. So she gets this eye infection and she goes into an urgent care facility and she fills out everything. She has her mask on, she has her hand sanitizer, and she gets called in the back, and the nurse does the workup. The nurse clearly foams up, puts on gloves. She watches all of that. She enters into a room to wait on the provider. The provider comes in. He does not wash his hands at all. He proceeds to walk over to the young lady, ask her a few questions about her eyes, and with his bare, unwashed hands, get ready to touch her face and her eyes. Now, if you got the pink eye and it's the middle of COVID and you're a doctor, you just walked in from outside from seeing several other patients and I don't know what they have. And you want to touch my hands, they're not gloved, and I have not washed you, sanitize your hands. That is dangerous. That is infection city on top of what that young lady already had to continue. Well, you know what she was brave enough to do? She was brave enough to ask that physician to please stop for a moment and could she watch him either wash his hands in the sink or foam up with some hand sanitizer. Now, you might run across some physicians who might push back a little bit, but you are in control of your body. You are in control of your atmosphere and your own life to a certain extent. And I would suggest to all of you to take back your power. That's the one thing, if you can't do anything else, you make sure you look and watch to make sure that your providers are vigilant about taking care of hand hygiene. If they care enough about washing their hands before touching you, then they are an awesome doctor. They are an awesome doctor. That's the in your hands. So the same thing I would suggest that you ask your spouse, your children, your clergy, anybody coming to visit you, give them the hand sanitizer. Nobody should feel bad about wanting to keep you safe. And you should not feel bad because you don't want your child ending up in the hospital. I carry my hand sanitizer around religiously, and I'm okay with sharing it with my friends. So be okay with sharing. Please wash your hands. Is there
Right.
anything you want to share about that, Brenda?
Well, and Denean, I know, especially let's take it back to the hospital system when you're asking the physician and you're asking our listener to feel empowered to ask them. And a lot of times, sometimes we may feel a little intimidated when either questioning a doctor or asking them to do something different. But isn't hand washing, the hygiene part of that, isn't that a requirement of
It
the
is.
hospital system? They're
It
supposed to be doing that anyway.
absolutely they're supposed to be doing it. And nobody wants to be necessarily called out for not doing something appropriately. But what it also says to the doctor is, well, if they're watching me to make sure that I'm doing the right thing by them, then they're probably watching everything else that I do. So remember we talked about the pen and the pad. If that person didn't wash their hands, first of all, be okay with them not touching you. It's okay. But I even think just entering the room, not I think, it is a hospital policy that if a provider is coming in to visit you or talk to you, they still should foam up or wash their hands, even if they never touch your body. You got to think about how many times the doctor has come around the bedside, maybe not touched the body, but touched the rails of the bed. Now they just left somebody else's room. You don't know what that other patient had. You don't know what they touched outside in the hallway. And so the handrails of the bed, or the nurse with the IV pole, or my nurse just came in to give me a blanket or a pillow. Well, where were their hands prior to coming in to give you the items you asked for? Now they're contaminated. So we don't want any what they call cross contamination in the hospital system. So their number one priority in every hospital system in the United States of America and abroad is hand washing.
Mhm.
I mean, think about it. We have been hearing hand washing, even all through the pandemic, all through COVID. Hand washing, ladies and gentlemen, really does help to save lives. So, if
Mhm.
nothing else, that is something you can easily do. And when you wash your own hands. Think about when you go to the bathroom. You just use the bathroom. Think about at a restaurant. When you go in the restaurant, you see the signs on the wall saying all employees must wash their hands before they come back in. You don't want them touching your food and your items. Well, it's not just that. If you don't want them touching your food, why you want them to touch your body without washing your hands? Does that make sense? It doesn't.
Nope.
And I think it's just how you don't have to be accusatory. You don't have to say, I didn't see you. But you can say, well, I noticed the hand sanitizer is empty. Or Dr. Green, I didn't notice you used the hand sanitizer when you came in. Do you mind if we both foam up?
Mhm.
Or you're welcome to use the sink right here with soap and water to wash your hands. Or thank you for using the hand sanitizer. And then, I do that one a lot. I like to tell them thank you. And then they realize, oh my gosh, I didn't do it. So then they do it. Or I'll say, even when I don't see them, thank you for washing your hands. As a matter of fact, I'm going to foam up too. Let's foam up together. Let's sanitize our hands together. Remember, we're in a team.
Right.
So if we're in the team, this is a part of the act of being in the team. So we're all going to be on one accord with washing our hands.
Yeah, this is some great information. And just like you mentioned, something as simple as washing our hands is life saving. It really is. Because these viruses, especially the viruses that we're between
Mhm.
coronavirus and the flu virus and the cold virus, if they're not being directly shared with each other, it's indirectly through touch or
Yeah.
surfaces and things like that. So, and we spread it to each other. So
We
that's
do.
one of the ways to prevent spreading or sharing this virus
Mhm.
is by hand washing, something that's so simple, but
Mhm.
is so major as well. So wash those hands. Keep washing.
Yeah. And people say all the time, oh, I fist bump. You fist bumping your doctor? Did he fist bump you when he went and put that stethoscope on your chest? How he
Right.
touch you? So when he got ready to come and look into your eyes, or look into your ears, how did he not or she not touch you?
Yeah.
So, or they looked at your body or wherever. They need to make sure that they are washing their hands. And so do you. So do you. If you're impatient, you might be sick, but you ask that nurse and doctor for a basin and soap and water and wash your own hands. Put some hand sanitizer on, especially before and after eating, and definitely after using the bathroom or your restroom and coming back out. That's important. Before any loved one does anything with you, when they come to visit or when they're touching and talking to your child, go, it's all right. Keep you some hand sanitizer by the door. COVID or not, you have a stationary site by your entrance door where when people come in and out, and don't get me on it, this is probably not a part of what we should be talking about, but I believe in taking your shoes off too. My big mama said, take your shoes off at the door. And if they're your company, they should be okay with it too. Provide them with some socks if they're concerned about how their feet look. But definitely, you don't want any additional germs in your domain that's not necessary. So if you're not going to do the shoes thing, then be okay with, even if you don't want to give it to them as a gift, just have it at the door. Have it at the door. Before they eat, you do it when you go out to lunch. You do it when you go to dinner. Start teaching your children to do that. My little girl is 9 years old, and she's okay with going to school and carrying some hand sanitizer and making sure anybody at that table, if she has to sit next to somebody, that share the hand sanitizer. We do it as adults. Let's teach our children to do the same thing. Have that same great life-saving habit. Hand hygiene safety is so simple, and we all can do it, Brenda.
Right. And I just want to say again how important that part is. I know a lot of times, especially, I think about the times I've taken my son into the ER, and it could be something that's not related to a virus. And sickle cell can impact your body so many ways. So it could be a pain crisis. But we also know that the ER, the hospital, is full of sick people with so many
Yes.
different things. So one thing, we don't want to go in with a pain crisis and end up with something in addition that could be prevented with hand washing.
Mm.
You know what? So I think about that as well. Actually, I had to think about that a couple of weeks ago with the ER visit. It's like, okay, there's a lot of respiratory illnesses going on right now, and COVID, the Delta
Oh,
variant is out there, and we had to go, but
mhm.
I did not want him to pick up something in addition that we didn't come with. So it's very important to pay attention, and we may think it's so small, but it's huge.
Mhm.
We have to be particular. We have to advocate, and like you said, instill it in our kids so they
Mm.
automatically know that to do that.
Absolutely. And people say, well, the hospital around this time should be one of the cleanest places. No, it's not. If
Mhm.
you're sick and you're filled with germs and infections, it should stay as clean and as sterile as possible. But sick people are going. And you're right. When you're in a crisis, I can imagine you're probably not paying attention to just simple things like hand hygiene. But those small things can make a difference for your child in his or her recovery. It can. You don't
Mhm.
want to deal with a sickle cell crisis on top of bringing any additional germs back home to your kiddos or any other family members. So be okay with handling that sickle cell crisis, but whoever is coming in, be all right with making sure that they are, number one, masked up. They need to always have their mask on, and I'm sure they will, but making sure that they just don't have on gloves without still foaming their hands up. So even if your provider wears gloves, they should still wash their hands or put on some hand sanitizing foam before putting the gloves on. That is hospital policy. That's the policy. And if someone has a problem with doing that, then I would just suggest they bring somebody else to the room who can.
Mhm.
And remember, if you are documenting, you walking in with your pen and pad, oh, they'll be so happy to do it. They will thank you for reminding them. And you come back and tell me and Brenda if they said thank you.
Yeah, let us know. You guys, we're talking to Ms. Denean Greene-Rivers about self-advocacy, improving our healthcare experience, navigating that healthcare experience. She's talked to us about the questions we should ask our provider, the communication we should have with our pharmacist, and hand hygiene.
Ooh.
Wash those hands. And she's provided us with example questions, or sample questions to ask, different scenarios to ask for the hand washing, and that should make you feel more empowered to be in a position to be okay with, number one, asking your provider, or asking your family member, or asking whoever it is that's caring for you or your child. Be empowered. Man, Denean, this is a great, great discussion, and I appreciate you so. I appreciate you so.
No, you're so welcome anytime. And I think what's really good about this, number one, the work that you do and the Be Strong group does is absolutely phenomenal. So we thank you. I'm so honored. It's wonderful to have minority nonprofit driven nonprofits in our area, and for you to allow a resource like this to the community. And a lot of what you talk about, I know, is in a lot of your listeners and your onlookers' minds, is specific to people who have sickle cell or advocating for someone with sickle cell. But a lot of this material really is applicable to all of us, to
Absolutely.
everybody. And if we are truly our brothers and sisters' keeper, if we really are, then all of this information we won't keep to ourselves, that we will gladly share with the rest of the world so that they can, and share with others they come in contact with. So, but I always want to say hats off to you and the team there and the production team there. You always do a wonderful job, and I'm just excited about the work you're doing. So, hats off to you.
Oh, thank you so much for that. Thank you so much for that, Deneen. It's really an honor to meet such wonderful people, knowledgeable people, and it's such a blessing to me to not only have you as a fellow advocate, a fellow member of the Patient Advisory Council at our local children's hospital, but as a friend as well, as a fellow mom, that I can speak to. So I appreciate that so much. Um, this was part two of our conversation, you guys. So if you haven't listened to the first part, you could do so. Share this information that you heard tonight. It can benefit so many. And she said, we are our brothers and our sisters keeper, and we're in this thing together, especially during these scary time.
Oh,
And we're coming up on, back to school. That's something that's kind of nagging at me right now because we were 100% virtual last school year. And so we're coming into some different time concerning with that Delta variant, those COVID numbers. So, but we want everybody to remain encouraged,
yes.
to still be empowered, share the information that you've learned through these videos, through following our nonprofit, the things that you've learned about sickle cell disease. Share with your family and friends the importance of donating blood. And if you take a look at our Facebook page, you'll know that we have another blood drive and an event coming up on August 28th, Cycle for Sickle Cell, and it's actually a free community event. There will be a blood drive. We're honored to partner again with Richland County Recreation Commission, as well as the American Red Cross to put this event on, and many community members as well and organizations, and we're going to give them a shout out to this upcoming week for helping us put it together. But Deneen, thank you, thank you, thank you. How can people get in touch with you? Or if they have any additional questions, where do you want them to send it?
Oh, well, I am working through a company called I Advocate, but you can email me directly at Denean G. That's my first name, Denean, the letter G, as in green. That's my maiden name. And no relation to Brenda, even though I feel like not by DNA,
Right.
not by DNA, but Denean G at yahoo.com. Certainly reach out to me there. And we are always, or I am always available through the Children's Hospital too. So you can contact the Family Advisory Council at Prisma Health Children's Hospital and reach out to me in that capacity, and through I Advocate. So I'm really excited that you've given me this opportunity. I'm always available. And I will put this little caveat out for, and you didn't ask me to, but I always tell people who say they can't give blood, find someone who can. You can't give blood, give dollars, give time, give resources. You can give in other ways if you don't have or feel like you can't give your blood. There's somebody next to you who can. And blood saves lives, just like hand hygiene, proper hand hygiene can help save lives. We know for a fact that hand hygiene works, and giving blood helps to save lives too. So I appreciate you doing that. But let's don't forget, none of us are exempt. There's always a way for us to give back in our community, and definitely always a way to give back through the Be Strong group. So,
What she said. What she said. Somebody did ask, can you tell us the next blood drive date again? It is Saturday, August 28th, 2021. It's the Cycle for Sickle Cell event and blood drive. It's a community event, free. There'll be educational vendors there. We will serve lunch. We will have snacks, giveaways. It's a time when our community can come together to spread awareness and support our fellow warriors in donating blood. And I know we always use the hashtag blood is love and blood is life. It truly is. So click on the event on our Facebook page to find out more details, but we will love to see you there. It will be from 9, the blood drive is from 9 to 2. The event will be from 9 to 3. Come, we have so many exciting things to share with you on that day. So with that, we look forward to our next Tuesday chat. We will have another great topic to discuss with you. And we're so excited. You'll see more details popping up on our Facebook, Instagram, and on our YouTube channel about what our next topic will be again. Again, thank you, Ms. Denean Greene-Rivers. And thank you guys for listening. And thank you guys just for tuning in every other Tuesday. Good night.
Good night.